This is Carol. I think the advantage of the insured patient is you're more likely to be paid as long as you're following all the payer rules. But in an orthopedic practice, we often have patients with fractures and so forth who don't have insurance. We're on staff at some hospitals with a high Medicaid population and uninsured populations. So we're accustomed to seeing patients who do not have insurance, and we just work with them.
Thank you.
Hi, we just had somebody new pop into the call. I'm just seeing initials. DJ Hertz, do you want to introduce yourself to the group?
Sure, I'm Dennis Hertz. I am in Hershey, Pennsylvania, and I'm a member of MGMA and I guess a guest in the Pennsylvania MGMA program this afternoon.
Great, thank you for coming. We have a couple of folks here mainly from the Philadelphia, Montgomery County areas there. And then Carol, where are you located again, Carol?
Okay. Premier Orthopedics is Chester, Montgomery, and Delaware counties. We do, I think, have one division that has an office in Philadelphia. There are about 18 divisions within Premier, and the division that I'm with also has 2 offices in the state of Delaware. We're the only division in Premier that is in the state of Delaware. So we're pretty much the 3-county area, southeastern Pennsylvania.
And we were just talking about any experience you might have had recently with a shift to cash pay patients. If you've seen any recent experience with people losing their insurance because of COVID and making a shift to being cash pay. Have you had any experience with that?
Dennis, it's Carol. What specialty are you in?
Carol, I've been in multi-specialty practices with medical group and with and then working most recently with a revenue cycle company in Pennsylvania. And right now I'm not working, so I guess that's an open-ended question.
Okay. All right. Erin, were there other questions that were emailed to you?
I didn't have anybody email them in, but we are, the floor is open for other questions.
Good. Okay. Have any of you had impact from the storm yesterday? And I understand we have another one coming today. We were without power from noon until sometime early this morning, but now we're without internet. So Comcast has a widespread outage. And so, the technology is great, our EMR and so forth, but days like today and yesterday where we haven't been able to use them puts a real strain. Anybody else dealing with weather-related issues?
Yeah, hi, it's Linda. We had to close one of our locations yesterday as well, at 12:30 in the afternoon. And same thing, it restored somewhere overnight. Had to move vaccines because our backup generator was not working.
Oh my.
Yeah, people coming in late because there's so many roads closed around us in Chester and Montgomery County.
Yeah.
Thankfully, our phones and our internet are working, so we're able to work today.
Oh, that's good. Good for you. And Catherine, is your office in the city?
Yeah, we're based in Philadelphia. I'm actually out on Long Island for the past month or so. But I know a couple of my employees lost power yesterday, also around noon, and are having spotty internet today too.
Right. How about the practices that you work with in the city? Have they been open through COVID, or are you seeing them closed?
I'd say probably half and half. And also, I guess for some background about us, we're a very new startup. So I just founded it back in January. So we're still building up the practices in our network, and we have about 20 today. So just a small snippet of, the Philadelphia provider market. But yeah, I'd say half and half. About a lot of them have also been closed this week for in-person just because of the protests.
Mm-hmm. Linda, did you have any staff out because they tested positive?
No, none of our staff has tested positive, thankfully. We've been all healthy.
Yeah. Yeah. And have you had to reduce your staff size?
Oh, yeah. Yeah, we went from a staff of 35, including our providers, down to a staff of, I think, 9.
Mm-hmm.
It was for about a 6 to 8 week period. And we're slowly ramping up. This week, we're back up to 75%. We actually had closed one of our locations, reopened it this week, or I'm sorry, 2 weeks ago.
Uh-huh.
So it's
Yeah.
maybe going in the right direction.
Yes. Yes. And what types of precautions do you have in place in your office locations?
We have people calling in from the parking lot. They're actually texting to a cell number for each office, just saying that they've arrived.
Okay.
We call them back and tell them when we have exam room ready and tell them to come directly and go directly to the exam room. We're doing all of our check-in, pretty much our screening for check-in the night before to eliminate any at the front desk. And we have all well visits, in one chunk of the day and sick visits at the end of the day.
Oh, that's a good idea, especially for pediatric practice. I'm sure that helps the parents feel a little more comfortable.
Right. Yeah. Lots of televisits, which is great. And
Yeah.
Uber cleaning.
Yeah. We've been trying to do something similar with patients. They come in, let us know they're here, and we're asking them to go out to their cars. One office, the parking lot is a little bit of a walk, and since it's an orthopedic practice, we're really reluctant to have them have to go back and forth, crutches, walkers, et cetera. So we're just trying to schedule in a way that's thoughtful of our waiting room. Fortunately, at that location, we have 9 exam rooms, so it might mean that the patient sits in the exam room a little longer than they would have, but it's better than sitting in a waiting room. So we're rooming them. We're taking the temperature of every physician and staff member when they arrive in the office each day, and we're recording that, and we're taking the temperature of every patient when they arrive.
Yeah.
And as you said, yeah, cleaning.
Yeah. And they've also ordered barriers for our front desks, which haven't arrived yet. Because we're open, our front desks are open, completely open.
Yeah, we ordered the sneeze guards. Did you see the price of those? That's ridiculous for a couple of pieces of plexiglass.
Yeah, we had, I ordered something, it was actually custom made for us. And it wasn't, I would say it was about $1,200 for each. And I think it's going to be here for a while. And with our traffic, we felt it was, we had to bite the bullet and do it.
Yeah, we had actually, in the last 5 years, taken down a lot of those barriers to, to take away that feeling. So for now, we just have kind of I call it a tripod. It really isn't. It's plexiglass on legs, and it protects the staff. But, we're going to have to wait and see. A question that I'd like to put out there, what kinds of issues or projects do you feel like have had to take a back burner because of all of the attention and focus on COVID? Are there things that you're saying, gosh, that had to be derailed and I'm sorry that happened?
So for us, we actually opened a brand new office in Malvern. We were looking to really ramp it up and do a ton of advertising. We're having we're gonna have a movie made and just advertising and having, monthly specialty talks in our practice, maybe on breastfeeding and nutrition and managing all kinds of different things. So that we were really excited about that, just kind of going in a different direction with the practice. And that obviously is on hold indefinitely.
Right. Yeah, a lot of our marketing for this division particularly, we do a lot of school fairs or sponsor a little league team, a lot of local sponsorships and advertising, and senior proms, school musicals, and all of those events were canceled this year. So we have to rethink how we stay out in front of our patient population and potential patients to keep our name out there.
Right, right.
Dennis, since you're looking at this industry from a little bit different perspective, what has been your observation?
Good question. First, the dramatic increase in telemedicine and I guess questions that come up when patients do not have an established relationship with the practice. Second is the drop-off in immunizations and other preventive care services. How would that likely be recovered over the next, hopefully, 3 to 4 months prior to the onset of the next flu season? And not a return of COVID, but potentially so. Third, how practices are finding new ways to provide care, not just through telemedicine, but other arrangements as well. And there's a lot of interesting models out there. And in fact, I was just looking at Catherine's with Civi Health. It looks to me like it's an inner-city practice, and it's not dependent upon insurance. And so I'm just wondering, Catherine, how that's working so far, and what caused you to set up a practice that way, and what the opportunities are that you see.
Yeah, happy to talk about it. So I guess to clarify a little bit, we're not a practice. We are more of a platform that connects cash pay patients with practices who offer upfront, transparent prices for care. And I started it because I was actually, so talking about myself, I'm an MBA student at Wharton right now. Previously worked at a health plan up in New York for the CEO and CFO there, and was also uninsured myself for a bit of time, and just got really frustrated as a patient trying to find a provider, figure out how much my out-of-pocket cost was going to be, go to the doctor, and then still get surprise bills afterwards. It was only for $300 to $400, but for me that was more than I was expecting to pay, and I just wish I had known in advance what that would have been, and I probably would have gone somewhere else had I known that. Not necessarily for the cheapest place, but just to be able to plan in advance. And I just know a lot of people who've been in a similar situation, whether they're, self-employed freelancers, gig economy workers, small business owners. And so I started Civi Health to try and make finding and paying for healthcare as simple and stress-free as possible. And so we're actually just building up our network now with practices in Philadelphia who are interested. And basically the way it works is a patient goes on to Civi Health, they select the provider or practice that they would like to go to, and at the time of them booking their appointment online through us, they're actually paying upfront. And so when they go to the practice is guaranteed payment, and the patient also knows how much they've already paid. So the thought is that it's a win-win for both the patients and the providers, and they can focus on care as opposed to having to collect on bills after the fact, or get surprise bills or have that negotiation with an insurance company, because the practices actually set their own rates on our platform. So far we've been building the network for not very long, about 2 months now. But I'd say the hardest part for us has just been getting in touch with practices with COVID. A lot of them haven't been answering the phone, but the ones that we have been able to get in contact with have generally been, yeah, this seems like a good idea. I get paid up front, I get to see patients, and I get to keep doing what I like to do, which is providing care. So that's, I guess, kind of where we are now. I don't have a ton of insight beyond that yet, which is why I was excited to come to this and kind of hear what you guys and more established practices are thinking about and how we could potentially help.
So, Catherine, so how does your organization generate revenue? So you collect the patients and then practice acceptance?
Sorry, it's going in and out right now. I can't quite hear what you said.
Okay, sorry.
Yeah, Carol, you're
Organization. Am I still breaking up?
Yeah, maybe
a little
in the
bit.
chat. I don't know if you can put it in the chat, but I'm happy to read it there.
I actually came outside when you were having trouble hearing me, so
Oh, yeah, that's
thinking
better.
that
Oh,
maybe
now I can hear you.
okay. My question was how your organization generates revenue. So if you negotiate with a practice to see the patients through your organization and the patient pays you, then does the practice accept a discount from what you collect so that some portion of what you've collected stays with your organization?
Yeah, exactly. We're trying to make it as simple as possible. So I'm also curious, some stats out there are that practices can spend up to, 10 to 14% on billing and other administrative related costs. And so we're kind of thinking with Cibi, if we can take a flat booking fee for those and you don't have to deal with payment afterwards, that would be beneficial to the practice. And we also have more of a membership model where you can just pay a fixed fee deducted per month, and anything on top of that, 100% of it goes to the practice. I'd also love to hear, from you guys, what makes sense on your end. We're just figuring out our revenue model now. And I really want it to work for the practices so that it's something that's really useful and not a burden. So I'm curious, what you would think of as something that would be helpful and not an annoyance. And of course, you're setting your own rates. So you can set that price, $5 higher so that the net amount to you is the amount that you want. Not sure, did that answer your question?
I think we, I think we actually lost Carol, her audio on that one.
Oh yeah, she is too.
Yeah.
Getting back to what Carol asked me, it's just one more example of really some new innovative ways to work in this field and to provide healthcare. Catherine, I'm really struck by how portable this sort of an approach could be. And was this part of a service that you've worked with elsewhere, or is this a model that you're going to duplicate in other areas? And also, if you wouldn't mind commenting how you market this to patients, because patients have to find these folks.
Yeah, so I have not really seen this in the healthcare space, but this type of platform exists in a lot of other industries. So I'm just trying to bring this into healthcare. At least, my prior role just saw some of the systems on the back end, and I just was always so confused why payment happens after something's been provided. And I know, obviously it gets complicated and things come up, but sort of fundamentally, why is the service not tied to the value that you're, paying? And so that's kind of got the idea from other industries and trying to bring it into healthcare on that end. And then to answer your other question for getting it to patients, we're partnering with organizations and employers who may not provide healthcare or sufficient benefits to their members or employees as sort of a B2B2C channel to get directly to the patients who need something like this, in addition to a regular direct-to-consumer. So like one example is an organization it's a national organization of farmers, and these are typically people who don't have health insurance, who don't want to pay, $600 per month out of pocket for a premium if they're not getting care, but they still need care and they still want care. and they just don't know exactly where to find it, and they're a little worried about how much it's going to cost. And getting, you know, a surprise couple $1,000s in the mail is not what they're looking for. But with Civi, if they it for $200 or $150 and, you know exactly what that lab test is going to cost, or they can use us and have that peace of mind and actually get the care that they need.
Mhm. What happens when a patient needs to be referred to another specialist where there's some more expensive testing that's not provided within the practice? And also, are there issues with physicians or providers who may be contracted with insurance as part of you know, a more traditional practice and then also provide care through your platform?
Yeah, actually, have so far see multiple different types of patients. And what I found is a lot of practices already see both insured patients and cash pay uninsured patients. So we're just think of us really as a platform to help practices get paid and get those patients. So you can totally do both of them. And to your point about patients needing to go elsewhere, I think, you know, patients today, when they go, they get referred and need to go elsewhere, and it's a totally opaque process. So with Civi, you know, as we're building up our network, the plan and what we've started to do is try and trace what does that journey look like for a patient, and try and have providers or, you know, labs, radiology centers, so that this patient can continue their journey through Civi Health and get the care they need. And, you know, for some of the primary care providers that we have, they like the idea because today they see a cash pay patient and they're worried to send them somewhere else that they won't actually get the care. But if they know that there's a provider on Civi and this patient can book in their office through Civi with that provider and see the price in advance, they feel a bit better that the patient is going to get the follow-up care that they need.
Thank you.
These are all questions that I've been thinking about for the past couple months, so I'm glad you asked.
Carol, are you back now? We have a couple new phone numbers logged in. Do we have anybody new jump onto the call now?
Yes, this is Karen Davidson.
Oh, great. And you want to introduce yourself?
Sure. Sorry I was running a little bit late and I couldn't jump on the computer, so I don't know if you guys are all on the Zoom, but I'm on the just on the phone call. So I'm a healthcare attorney. All of my clients are physicians or practices, and you know, I represent a lot of practices in the Philadelphia and sort of region, as well as individual physicians all over the country. And I do both transactional work as well as regulatory work, so as well as reimbursement. So I've been involved with MGMA in various capacities over the years. And when I saw that you all were doing these calls on Thursdays, I thought, well, let me sort of see if I can add anything to the conversations. So that's the reason for me jumping in. So nice to meet you all. So I'm interested in the model that you were just sort of speaking about, and whether or not you've sort of, you know, obviously I'm always wearing my attorney hat, and so just wondering if there's been any discussion about sort of the regulatory issues, or, you know, things like fee splitting or things like that, and how you've sort of dealt with that.
Yeah, that's a good question. So the advice I've gotten so far, and we would love to hear your thoughts too, is so we're not dealing with Medicare, Medicaid payers. It's all cash pay, you know, paying with your credit card, your HSA card, your debit card. And we take a booking fee or a membership fee as opposed to a percentage of the price. And it's my understanding that doesn't break the fee splitting laws or the kickback laws, as far as I know.
Yeah, and I would probably, you know, obviously need all the facts and circumstances, so I'm not giving a legal opinion or anything, but I think, you know, in general, if you're doing some sort of subscription or something like that, I had thought I heard you saying that there was a percentage of the fee, but
glad that that's not the case in terms of, you know, and the practices obviously would need to look at, you know, sort of the arrangement. You're right in terms of federal anti-kickback and Stark laws. The, you know, we're not dealing with Medicare or Medicaid patients, but in different states you can have all payer statutes, right? Like New York, Pennsylvania has our, you know, our motor vehicle or our workers' comp laws kind of bootstrap the Stark and anti-kickback laws. So, but I was just curious about that.
Yeah, definitely a good question. And as far as I know, it's not an issue, but, you know, once we've grown a little bit bigger, I think we'll definitely look into this further. But yeah, it's my understanding that we're not breaking any laws. I would not plan to do that either.
Right, and I would imagine that the practices would want to make sure that was the case too, right?
Yeah, and so far have not gotten any concern from them.
Okay, well, thank you so much. I just in terms of just general, you know, what I'm seeing is as a healthcare attorney representing practices, I'm, you know, obviously the, you know, cash flow of the practices has impacted physician employment, and I do, when I represent practices, I do draft and negotiate employment agreements. But also, you know, when I'm representing individuals, I negotiate them with the practices, and just sort of seeing what the impact of COVID has been on some of the specialists in particular, you know, and how some of the practices are dealing with either pay cuts for the doctors or other staff. You know, whether people are being furloughed, whether there needs to be amendments to any of the employment agreements, things of that sort. That's kind of what I've been dealing with at my end. So happy to answer, you know, questions or hear about anybody else's experience in that regard.
I think that from what I can tell, the other folks that are on the call are not direct practice administrators at this point. We're all, you know, in other sort of tangential roles at this moment. At this point, I know Linda had to pop off. Does anybody want to talk about other trends they're seeing in the industry right now? It's interesting to hear. I'm glad that Catherine was able to share her new trend, her new idea. I'm sorry that Carol couldn't stay with us. She's a good moderator, better than me, I suppose. I know that, so we're having these calls every week, and we have a different group of people kind of logging on each week. If some of you want to pop on again next week, we would be happy to have you do so. We kind of have a different group sharing experiences. No, yeah, Carol says she's back on, but we can't hear her. Yeah, she's having some technical issues today. It's that storm really hurt her telecom. So I would like to invite you all to pop back on next week if you're able to. And I want to thank you, especially Catherine and Dennis, and I'm sorry that we didn't have more practice administrators that were able to share their experiences with some of you today. But I want to thank you all for attending and hope that you'll jump back on again in the future. if we did make a recording today that we'll send around to everybody, so you can hear the beginning of the call if you missed it. But thank you very much, and hope to see you again at another PA MGMA program. You all have a good day.
Thank you. Nice to meet you guys.
Yes, very much. Thank you.
Thanks so much. Take care.
Bye-bye.